So
Okay.
for someone like myself, who my father mentioned our family history, his mother, his grandmother, had macular degeneration and went blind, and he's got cataracts. I mean, what can I do? I'm 40 years old. I eat a very clean diet, lots of fruits and vegetables, like you just mentioned. You mentioned some of these supplements as well. Is there anything else that I can do for preventative things to sort of, minimize the risk of me getting these conditions?
Well, you're doing the foundation of what you need to do, which is eating a healthy diet. And what I usually tell my patients is, it's not just carrots that we all need for our eye health. That's true. We do need carrots, but we need the whole spectrum of antioxidants, phytonutrients, and minerals as well. And so there are probably over 20 nutrients our eyes need to stay healthy. And the best way to get that is by eating lots of different plants. So I really advocate for, it doesn't necessarily have to be a plant-based diet, but a plant-rich diet. And what I usually tell my patients is, cycle through your fruits and vegetables. Don't just eat the same thing every day, and include lots of different colors in your diet. So, what I tell my patients is most people eat three meals a day. So that's 21 meals a week. 21 meals a week. Have 21 different colors in your diet. So have that rainbow of colors. So have your reds, your blues, your oranges, your greens, your purples, sometimes even your blacks, and you'll get all those nutrients your eyes need to stay healthy. Now, another question a lot of people ask me is, especially now because we're on our screens all the time, what is the potential negative impact of all this screen time and blue light on our eyes? Well, what I can tell you is, first of all, there is no evidence that blue light will permanently do any damage. So fortunately, we don't have to worry about losing vision permanently later on in life, but definitely it can contribute to digital eye strain. So especially someone like yourself who's younger, or even children, we're on our screens. How can we protect against digital eye strain? And one of the best ways is actually nutrients that many people probably haven't heard of, but there are 3 important eye health nutrients called lutein, zeaxanthin, and mesozeaxanthin. And I like to call them vitamins L, Z, and M, even though they're not technically vitamins, they're eye health nutrients. And these are really potent carotenoids found in our retinas. And what they do is they basically help absorb some of that blue light as well as UV light, neutralize it, and protect our retinas. So if you're going to do one thing, eat a balanced diet, but also perhaps even to get an extra kind of protection shield for your eyes, perhaps take a supplement with that combination of lutein, zeaxanthin, and mesozeaxanthin. Really important.
Dad, are you familiar with that third carotenoid that she mentioned? I had not heard of that before.
Meso, M-E-S-O, zeaxanthin?
Yes, mesozeaxanthin. No. So the body converts lutein into mesozeaxanthin because it's not so readily available from foods. Like it's available in certain types of seafood, for example, some trout. I think shrimp and krill have mesozeaxanthin, but it's very, very small amounts. So the best thing to do is have lots of lutein in your diet, but also perhaps take a supplement. And there's actually one ingredient that has all 3 of these in it. And this ingredient is found in many of the supplements on the market. The ingredient is called Glutamax 2020. And what I usually do is actually I'll just show you here. I have, I don't know if you can see this here.
There sure. Go. Yeah. Okay.
So if you look at the label on the back, and when you're choosing an eye health supplement, look at the label. You'll see lots of ingredients, but look for Glutamax 2020 because again, that's the ingredient that has all 3 of those important macular carotenoids. And the reason why that meso is so important, the mesozeaxanthin, is because it's right in the center of our retina. It's what gives us our sharpest vision. We need to protect that area the most, and that mesozeaxanthin is where is located right there in the center.
Now, how do you feel about astaxanthin? Have you come across that?
Absolutely. So I'm so glad you mentioned that because astaxanthin, even though it's not found in the eye, it's not located in the retina, there are many studies that have shown that astaxanthin, some people even call it like the king of antioxidants. It is so potent and it does get into the eye. There are some studies that have shown that, for example, people who've had cataract surgery, the astaxanthin actually helps to decrease inflammation postoperatively, and it also helps with blood flow to the eye, blood flow to the choroid, which is in the back of the eye. So lots of studies. It's really an exciting nutrient to consider when you're thinking about eye health.